Don't forget to sign in on Pull Everywhere. And we don't forget to show up Thursday, or Wednesday, on time. That'd be awesome. Still 12:30. Still at 1:40. Means you have 65 minutes to complete the test.
How many questions?
32. 32.
That's doable. Wow. That's like 2 minutes a question. And then you've got wiggle room.
Okay. I'm glad you got that.
That's my plan for it.
Yeah. You can wiggle for a minute. Okay, so, all right. Anybody have any questions about anything? Yay. Yes.
Ethics, we already need to know those terms.
Ethics, you need to know those terms. Good talk. Again, look at your study guide. It's written on there what I want you to know. It's not like I'm trying to hide what I want you to know. That are going to be in
You
these
posted
kind of
like
formats.
3 of them though, so I'm just curious which
The
one.
last one, it has all the objectives and it has associate study guide information with it.
Okay.
Okay? That one is complete. And that's it. There are no questions on the test that are not objective or assessed by those objectives and can be answered by knowing what I said on the associate study guide information. Okay? Having said that, they're all in kind of case study format. So make sure you are studying case study format. I've given you, what, 2 or 3 different PowerPoints loaded up there for you guys to look at. Okay? A new one this morning, which we will go over, just in case you do not want to do it on your own. So, starting here, Cynthia is a 40-year-old woman.
Woman.
It's woman, and it's one woman. There's more than one, by the way. Comes into the emergency room complaining of coughing, wheezing, and difficulty breathing. She says she has seasonal allergies, and that exercise and pollution make these symptoms worse. She also says that she was here a few days ago with a URI. What is Cynthia suffering from? Asthma? Okay. Why not acute bronchitis?
The thing that like triggered me was allergies, exercise, and pollution.
Okay, so you went with allergies, exercise, pollution.
Yeah.
That's 3 of the ways that you can get asthma.
Yeah.
Okay, good.
And wheezing.
And wheezing.
Yeah, and wheezing.
What's the reason?
Yeah, it's up there, see?
Oh, yeah, wheezing.
And difficulty breathing is another
Yeah,
one.
and there's no infection signs, right? They would have said something about coughing with some nasty crap or acute bronchitis. Okay? 35-year-old man named Bill enters ER complaining of a severe headache that comes and goes, tremors, and also states that he has been very anxious and can feel his heartbeat grow faster. Bill states that he has been experiencing these symptoms for a couple of days after competing in a basketball game with some friends of his, and his symptoms were not getting any better. His blood pressure is 160/95. His respiratory rate is 30. You also notice that Bill is diaphoretic. And remember the classic triad? What will be the most likely diagnosis?
C.
C?
That's the
Because
triad.
the triad is,
I just associate it with the triad.
so what's the triad?
Isn't that the symptoms?
Yes.
I can't think with this music. You gotta turn it off.
Oh, man. Christmas haters. That's what it is.
No.
Christmas haters.
No, I just want to hear.
What?
I just can't hear what
What?
you're saying.
We do this all day.
What?
What? The triad. What is the triad?
So high
You
blood
promised to tell me the triad
pressure,
of?
the blood pressure, the respiratory rate, right?
High blood pressure.
I'm just
headache,
kidding.
And sweating.
High blood pressure, episodic headaches, and sweating. So diaphoresis, tachycardia, and episodic headaches. Okay? What do you see in there? Do you see that triad in there? Hiding out. Severe headache comes and goes. That's episodic, right? Heartbeat, increased heart rate. Sweating somewhere there. It's a little quick, but nothing to stress about. I mean, 12, 16, 22, over that, it is kind of fast, really. But yeah, it's pretty fast. Okay? 45-year-old male brought in complaining of severe lower back pain and complains of abdominal tenderness upon palpation. The patient is slightly feverish and complains of nausea. Due to a recent injury, he has been on bed rest and leads a normally sedentary lifestyle. He has been experiencing dysuria and hematuria for a day now and explains that he has frequent UTIs, but that the back pain is new. The pain radiates from his lower back to his groin. The patient also has a family history of hyperparathyroidism.
Kidney stones?
Like kidney stones.
Because of the PTH and the calcium.
Because of the
And if you-
PTH and the calcium.
Yeah, and then if you're
So
sedentary,
parathyroid hormone does what to calcium?
it increases
Increases it in the blood, which means it's pulling it out of the bone probably, right?
Yeah,
it.
so you're getting
That's
more
the
of it.
sedentary part.
Okay. Oh, okay, so he's sedentary. His parathyroid is pulling
Pulling it out of his bones.
calcium out of his bone, leaching it out of his bone, sticking it in his kidney, forming a kidney stone. It hurts, severe lower back pain.
Like,
The
Right.
nephron.
Huh?
Does that have something to do with the nephron too?
Has what?
Something with the nephron, with the thing coming down the nephron is hurting his lower back?
Yeah, it's probably that he's trying to pass a stone here. Yeah. He's got dysuria and hematuria. So yeah, he's probably trying to pass a kidney stone.
I don't really
What?
crap.
Yeah, that's
He
just
has
crappy.
an injury and then he develops kidney stones because of said injury. That sucks.
Yep. For job security. So that answer is what?
C.
C. Get it wrong because you don't remember what nephrolithiasis means. Yes.
Sorry.
Yes.
The one before this, I
Uh-huh.
don't remember going over answer C. What chapter was that on?
That was in endocrine stuff.
Very last slide.
Ooh, last slide in endocrine, no less. Somebody been doing her homework. Okay, questions? I don't understand. Here's the thing. When we were going over that pheochromocytoma, I literally walked right here and screamed at the top of my lungs right here about that fight or flight from a pheochromocytoma. You don't remember it.
No, I remember this.
I think I scared the thing right out of you. Everything we were talking about, gone.
Plus, you let out class early. So
It's
I
like the
got
last
sick.
5 minutes were just, whew.
Yeah.
I have no idea. He just screamed. Okay. That's good information to know.
Mickey Mouse.
You want to use my jacket? Do a picture freezing. Do you want to? It's right there. Keep it in the chair warm.
You're the chair.
It's up to you. All right, you suck it up, man. All right, Mickey Mouse goes to Disney Hospital because he's experiencing a severe headache, nausea, vomiting, and his vision gets blurry on and off throughout the day. It's starting to sound familiar. Dr. Duck decides to run some tests to see what is going on. Mickey's blood tests and hormone levels are normal. An MRI and CT were ordered based on the pituitary mass. Oh.
Pituitary.
Pituitary mass noted on the MRI/CT. What is Mickey's diagnosis?
Or non-functional? Because it's not. So it's non-functional because that's normal, right?
Yeah? Did we get concurrence in this?
Yeah, it's definitely.
Okay. Well, obviously he has a pituitary mass,
Yeah.
so that's a given.
Doesn't help anything.
Is it secreting anything? Is there any reason to believe that's secreting female hormones?
No.
How about any kind of Cushing stuff? How about any kind of other female hormones? So they're just non-functional pituitary hormones. Does that make sense? Again, students wrote this. I kind of like it. It's making you guys think something we never saw before. Get used to life from here on out. Then you have to figure out what it is anyway, right? That makes sense though, right? There's no reason to believe it's functioning, but it's still growing. Cool? Andrew, a 24-year-old Caucasian, came into the clinic with a presenting complaint of decreased urine output. Test results showed proteinuria, hematuria, and a decreased GFR. All other test results were, I'm going to say, unremarkable. Not
I think they
remarkable.
kind of answered it for you. It's
But
like kind of
significantly
bold.
indicating the presence of IgA deposits.
Yeah, I did it.
What diagnosis?
IgA,
Let's go with
burgers.
IgA nephropathy, since
Yeah.
you said that, right? Okay, keep in mind, IgA nephropathy is Berger's disease. You don't necessarily have to get both of them in your answer choice. Okay? That would have been a little harder if they would have said Berger's disease. It is a type of glomerulonephritis, by the way. Okay?
It's a type.
22-year-old college student comes into the hospital during finals week with vomiting, diarrhea, and confusion. Yes. She was brought in by her roommate who tells you that she's been distraught over a breakup with her boyfriend 3 days ago. Oh, this was rude. Right? Right? Physical exam and test findings include tachycardia, dehydration, and hyperthermia. 105 is high. You treat her for?
C.
See?
Hyper. Yeah. So is low.
Kill the cat.
I think it's C.
The wrong answer.
Cat. You never-
I think it's
answer.
okay. So I think it's
Why
C.
would that be a dumb answer? What?
I think it's C because of all of the like onset symptoms.
Okay.
It
This
seems more
definitely-
immediate.
This definitely could be thyroid storm due to Graves, assuming that you know she has Graves to start with.
Yeah.
That would be a really nasty flu. It's not that that could not happen. And I don't know that I could rule it out at this point from this information,
Yeah,
right?
it does give you diarrhea.
A flu would give you confusion though, but.
That would be a really bad flu to give you
Yeah,
confusion, but if it
because
gave you
the
105
fever is so
fever,
high, then it might.
you might be, although,
Yeah.
I told you about that typhoid fever I had at 105, right?
Well, and dehydration can cause.
Like that, man, and I was in blood test. I killed it. I was part of the test.
So diarrhea can cause confusion though.
If you dehydrate yourself enough and get diarrhea, yes, you can get confusion because of that.
Yeah.
105-degree fever, same reason. You can get confusion because of that.
Can you explain
You wouldn't have to necessarily say anything. I didn't write this, remember, these are students that wrote it. But I would have preferred to see somewhere in there pretidial myxedema, exophthalmos at least as a minimum to at least suggest it was Graves.